The 2-year follow-up of transcatheter valve replacement presented at the ACC annual meeting last week continues to show that TAVR is equivalent to surgery in terms of ongoing mortality. That, of course, is good news. Now in JACC, researchers from Canada report on some further good news. They studied the impact of mitral regurgitation on outcomes after transcatheter aortic valve replacement and importantly tell us about the impact of valve replacement on MR. They looked at the outcomes of patients with mild, moderate, or severe MR after valve implantation. Patients with moderate or severe MR had a higher mortality rate than those with mild or less MR within 30 days. However, the mortality rates after 30 days were similar. But here is the really good news. 1 year after TAVR, moderate MR had improved in 58% and worsened in only 1%. Severe MR had improved in 49%. Multivariate predictors of improved MR at 1 year were a mean transaortic gradient of more than 40 millimeters mercury, functional as opposed to structural MR, the absence of pulmonary hypertension, and the absence of atrial fibrillation. That helps us predict which patients will have MR reduction. So here are the 3 take-home messages. 1, moderate or severe MR in patients undergoing TAVR is associated with a higher early but not late mortality. 2, at 1 year follow-up, MR was improved in more than half of patients with moderate or severe MR at baseline. And 3, improvement was more likely in patients with high transaortic gradients with functional MR without pulmonary hypertension and without AF. I'm Peter Block, and this is a CardioSource Heart Minute.